Good afternoon and welcome to the COVID-19 update on Channels Television. I'm Millicent Walker. Here are some of the highlights this hour. Lagos State Commissioner for Health, Professor Akin Abayomi, tests negative to COVID-19. Secretary to the Government of the Federation, Mr. Boss Mustafa, gives a knock on his home state over low compliance to the coronavirus safety protocols. And United States nears 6 million cases of coronavirus, nearly a quarter of the world's total. We begin in Africa, where the coronavirus cases as at today stands at 1,245,230, while total deaths are at almost 30,000. The number of recoveries is nearing the 1 million mark. According to the Africa Center for Disease Control and Prevention, Central Africa has 53,665 cases, over 1,000 deaths, and 43,437 persons have recovered. In East Africa, 104 cases have been recorded, over 2,000 deaths, and those that have recovered are over 72,000. North African figure stands at 224,417, with over 8,000 deaths and over 158,000 discharged. Southern Africa is seeing a higher recorded figures at 670,084 cases. This is due to South Africa, the country in that region that has on its own 625,056 cases. West Africa, where of course Nigeria is, it has recorded 159,960 cases with 2,386 deaths and over 130,000 recoveries. The Nigeria Center for Disease Control last night announced 138 new confirmed cases and 2 deaths in the country. The cases are reported from 13 states and the FCT. Plateau led again with 55 cases, Lagos 15, Ebonyi 11, the same with Oyo 11 as well. 8 were recorded in Abia State, 7 each in Anambra, the FCT. Rivers, Kaduna State recorded 6 cases, 5 were recorded in Ondo, 3 in Kwara, 1 each in Bauchi, Benue, and Edo States. Till date, 53,865 cases have been confirmed, 41,513 cases have been discharged, and the death toll stands at 1,013. It's some good news coming in from Lagos State as the Commissioner for Health, Professor Akin Abayomi, has tested negative to COVID-19. This is coming 1 week after he tested positive to the virus in Lagos. The news was announced by the State Commissioner for Information, Mr. Gbenga Omotosho, via his Twitter handle, which reads in part, "It is with gratitude to God that I announce the recovery and subsequent negative test for COVID-19 of the Honourable Commissioner for Health, Professor Akin Abayomi. Following the mandatory isolation, the Commissioner retook a COVID-19 PCR test, which returned negative yesterday evening." Governor Sanwo-Olu, the incident commander, is excited by the news, urging Lagosians to realize that COVID-19 is still with us. They should keep obeying the guidelines, washing their hands, wearing the face mask, and avoiding large gatherings, among others. Professor Abayomi had announced that he tested positive for COVID-19 on August the 24th and said he was going into isolation. Let's go over to Delta State, where the government is still ensuring that schools in the state are complying with the COVID-19 protocols as directed by the NCDC and the Ministry of Education. The Commissioner for Basic and Secondary Education, Mr. Patrick Uka, who is still going round various schools in the 3 senatorial districts across the state as students write their ongoing WAEC exams, commended the students for their compliance to the COVID-19 protocols. According to him, more desks, furnitures are currently being provided to accommodate more students. This is in compliance with the social distancing measure to prevent the spread of COVID-19. Now, joining us right now is Mr. Patrick Ukar, the Commissioner for Education in Delta State. He joins us via Skype. Thank you for joining us on the program.
Thank you, and good afternoon, viewer.
All right. So tell us, in terms of what you've been doing, going around the 3 senatorial districts and monitoring compliance levels as the exiting students write their exams. What have been your observation as to the COVID-19 compliance protocols?
Well, as expected, because we had training for the teachers and we had people who came back to train the workers in the school on the COVID-19 protocols. What most is that my visits to those schools are not announced. In most cases, I park my car and I walk into the schools, and surprisingly, you find out that everybody was complying. And I think the reason for that was that we have so many people out there monitoring, different agencies in education that were out there monitoring, both the local government, the state, the health institutions, and whatnot. So I was quite impressed with what I saw. And for us to maintain this, everyone again, children in school now are quite matured in the SS class. We expect a tougher time when the GSS classes comes in or the primary school comes in. So our monitoring will have to improve upon, and we have to be stricter in regular response to check. So I'm quite happy the spacing, the readiness, and the consciousness among them. And in every school you enter, you see the Veronica buckets everywhere. There's soap and there's sanitizer. So we were quite impressed with that, which means that the consciousness it's really sinking into people.
Finally, how much perhaps is the state government looking at, especially the digital option in this new normal, seeing as we have to live with COVID-19 until we have a vaccine? What is the digital option for schools upon full resumption?
First and foremost, that's actually the new normal that we have to go basically e-learning. First and foremost, we have concentrated on our teleclass because that is about the closest thing that you can get to the people in the remote area. So the challenge we have with the e-learning is, one, what kind of the device we can use that can get easily to the very poor ones. Then fortunately for us, we have gone advanced stage on what we're going to do, which is to provide this hardware in stages until we're able to clean up. Fortunately for us now, we are currently in advanced discussion with the BRACE Commission on having an e-learning platform for the whole of South states. And we are really expediting action in that committee, and we are making sure that any moment from now we'll be able to roll out. But for us in Delta, we have concentrated on the teleclass. And that teleclass, we have expanded our curriculum or the scheme of work to cover both primary school, the junior secondary and the senior secondary. So now we have the exit classes going out. We'll now be able to concentrate on the rest of them. And we'll continue the e-class until we're able to establish fully an all-embracing e-learning platform that will be able to provide these services to people in the very remote areas of the state. But pending that, the teleclass. And it's been working wonders, and we have seen that the response we get has been quite impressive, that the consciousness of the children to sit before the television or before the radio to listen to those classes has really worked. And I didn't see much tension with the children writing their exams because they were really prepared for it. So we just hope that at the end, the results will be good for them. However,
right,
we are definitely going to on what we're doing right now, presently.
We appreciate your time. Thank you so much, Mr. Patrick Ukar, Commissioner for Education, Delta State. Thank you for joining us on the program.
Thank you, Millicent.
Now, the Secretary to the Government of the Federation, who doubles as the chairman of the Presidential Task Force on COVID-19, Mr. Boss Mustafa, is lamenting the defiance of Nigerians to non-pharmaceutical preventive measures. He expressed the worry while visiting the Federal Medical Center, Yola, the Adamawa State capital, where 8-month-old conjoined twins were successfully separated. He reiterated that simple measures such as wearing the mask remain the only sure means of protection against COVID-19 for now.
Driving here through the city, from Jamaica, from my house all the way to Yola, I noticed people moving around without face mask. And I was wondering to myself, what do they think they are doing? There is no show of bravery if you do not wear face mask. If you do not want to protect yourself, at least protect others. How do you protect others? You wear your face mask. In case you are infected and you are asymptomatic, you do not feel anything because you are young and agile. What about your aged parents at home? What about your relatives that have got underlying health conditions that you would expose them to the danger? My appeal to the people of Adamawa, and I continue to extend it to the people of Nigeria as I speak to them on a daily basis during the media briefing, is that for now, we have no cure, no vaccine on site. The only weapon we have is adherence with the non-pharmaceutical measures, wearing of masks, washing of hands or sanitizing them, keeping social distancing like we have done here today, and avoid crowded gatherings. And finally, if you have no business traveling, stay at home.
Cross River State Government is collaborating with fitness enthusiasts in the state to increase the awareness of COVID-19. Walkathon is a 12-kilometer walk and exercise to keep fit and stay healthy in the midst of the global health crisis. The Commissioner of State, Mrs. Betta Edu, believes that individuals who are physically active can fight the coronavirus easier. Now, during the pandemic, there's been heavy reliance on PCR testing, an extremely accurate but time and labor-intensive method that requires samples to be processed at laboratories. But as the virus continues its rampage across the country and tests remain in short supply in many regions, researchers, public health experts, they've perhaps added their voices about revising this long-held credo. And this is some experts in the US saying that maybe it is best, or rather time, that less accurate tests be done as long as they are administered quickly and often enough. For more on testing, we have joining us via Skype Dr. Peter Imuesi, a molecular neuroscientist, is also a research fellow at Aberdeen University, joins us via Skype. Thank you for joining us on the program.
Thank you, Millicent, for having me.
All right. What's your take on the numbers that we're seeing? In Africa, we're recording a downward trend. We're seeing a spike in Europe as they ease larger restrictions. And then we know what's happening in the Americas. What do you think the trend of the virus is in these regions?
So when you look at the situation in Africa, taking Nigeria into context, for instance, you know, despite the non-adherence to the non-pharmaceutical intervention, despite all the flaws in social or physical distancing, we are not really reporting high level of fatality as it was initially predicted by doomsayers. And when it comes to testing itself, I think we are still kind of far behind schedule. And by now, 6 months is enough for us to have learned the ropes and to be able to effectively optimize our protocols. We know that there are a few challenges within the country, and one of these challenges is the fact that you do have poor accessibility to laboratories. You also have issues of the time lag before individuals get their results released to them. So I'll give you a clear example. For instance, when you look at Edo State, for instance, you have, I think, somewhere around 4 laboratories. 3 are domiciled in Benin, then 1 is at Eros Specialist Teaching Hospital. Now, when you look at the Edo State in full context, for instance, you know that there are areas like Auchi, Akoko Edo, Igara, Igwebe, and the neighboring towns and villages. Now, how do you bring in your samples from those areas to Benin or to Ira Teaching Hospital? That is one issue. And when it comes to the transport of sample, again, we need to look at the other area when it comes to the science itself. We know that the real component you need to run your analysis is the ribonucleic acid, which is the RNA. So
yes.
RNA
Dr. Morrissey, yes, sorry to interrupt, but we need to go on a quick break. We have Dr. Morrissey back on and more stories when we return on the program. Please stay with us. Welcome back to the program. We've been talking to our guest from Aberdeen University, Dr. Peter Imoesi, a molecular neuroscientist. Thank you for staying with us. As you were talking about the testing using the example of Edo State.
Yep. Before we went on a break, I was trying to use the Edo State as an example, right? So the issue here is we do have accessibility to these laboratories. We have issues with transport of your samples, which could actually hamper your RNA integrity. And also, we're meant to understand recently that some of the laboratories in the country do close for weekends. So when you close for weekends and you have your samples in, let's say by 4 p.m. on a Friday, that sample is going to sit there wherever you're going to store the sample until Monday morning, and that will give you a stretch of about maybe 50 hours. And for this particular test we are conducting, you should be able to do your testing within 48 hours. So I think we should be very careful when we make claim that we have the capacity to actually do this testing. And I'm going to give you a clear example that even with the numbers we've reported so far since February to this very time, they are not really adding up for me. Basically, when you look at the machines we've got, we do have about 18 mega machines in the country, 18 of them. Then you have several laboratories, and I give kudos to NCDC for them to have been able to ramp up their laboratories from 3 or 5 up to 66, and you have the GenSpark machines at the same time. But here is the deal. When you look at a 384 well plate, what that means is that you can actually introduce 384 sample into one plate, and you run this particular plate. Then you also have other machines that also run on 96 well plates. It means that you can introduce 96 samples into this plate. But as a core molecular expert, you do know that you need to create room for control samples. So if you look at paracetamol sachet, right, you have the wells. So that's the way a plate looks like, a qPCR plate. That is the way it looks like. You have little tiny wells. So the bottom part is about 12 of those wells. So you could literally take out those 12 and introduce your control samples in those areas. It then leaves you with 372 wells for you to introduce your new samples. Now, in a single day, let's assume that the 66 laboratories, you have just one qPCR machine each. Now, one qPCR machine should be able to give you 372 samples in 24 hours. Let's say you're able to run just one plate in 24 hours. Now, when you multiply 372 samples by 66 laboratories in the country, in 24 hours, we should be producing 24,552 samples in 24 hours across the 66 laboratories in the country. If you do that in 30 days, you should be having 736,560. If you have a 26 well plate, you take out the 12 wells beneath, you have somewhere around 84 samples to introduce. In 24 hours, you should have 5,544. In 30 days, you should be having 406,320. That is the samples you should be reporting. But that is not what we have in the country at the moment. So it therefore boils down to the fact that we may have technical problems where we do not have the capacity to speed up our testing capacity. Now, when it comes to ramping up of your testing, there is a recommendation I'm going to give to NCDC if actually we do have the capacity we claim to have. Now, the recommendation is really simple. We do know that we are trying to set up sample point collections across this country right now, which for me is not a good idea. The way to go about this is really simple. One, introduce mobile collection samples at every given religious center. So I'll give you, for instance, on a Friday, you have the Muslims going for mosque. So you could bring in your experts, your task force into major mosques across the country. You take your samples. On a Saturday, you map out a strategy for mega churches. You go to these churches, depending on the size of your church, you strategize your people at some strategic locations to take your samples again. And when it comes to banking, for people to access the banking hall, You also make a recommendation that before you go in, you must take your sample. And of course, based on human behavior, you introduce something like incentives. When you take a sample from an individual, you could say, we're going to give you a branded mask, we're going to give you a branded t-shirt, we're going to give you a branded pen. This is going to
interesting initiative, Dr. Mercy. I really wish we had a lot more time to talk about this, but definitely you will come on the program again. Thank you so much, Dr. Peter Mercy, molecular neurosciences from Aberdeen. Thank you for joining us on the program.
Thank you for your time.
Well, over the weekend, the Lagos State Governor, Babajide Sanwo-Olu, launched a free care pack for COVID-19 positive patients who prefer home-based care. We have a public health physician who joins us here in the studio, Dr. Adewale Adebanjo. Thank you for joining us on the program.
Thank you very much. Thanks for having me.
So this is a sort of telemed, isn't it?
Yeah. Well, basically what the governor is just trying to do is that to really make sure that a lot of people do what we call self-isolation at home. Because we're so lucky in this part of the world that most of our cases are more of mild to moderate cases. And we realize that most of the isolation centers are actually underutilized because basically that should even be meant for people with severe cases. So those who have mild to moderate symptoms can actually self-isolate by their home. They can really get well if they observe certain precautions. Of course, before this whole management could actually work very well, there are certain things that has to be put in place. Number one, there should be a clinical assessment of the patient, and which should be on each patient basis. We have to consider certain things like patients who are vulnerable might not be able to do what we call home management, like people above 60, people who have other comorbidities like people who are hypertensive or diabetic, people who are asthmatic, and also depending on the kind of the presentation, people who actually present with a very high fever of over 30 degrees centigrade, people who are dyspneic, having some difficulty in breathing, those kind of patients might not be able to self-isolate. But majority of the cases, about 80% of the cases are just mild to moderate cases, and they can actually self-isolate. So management can actually work for people like that.
What about the residential setting?
Now, in residential setting, that's where the issue has been, because we will realize that most households, it's going to be difficult to see where you just have just one person occupying a room, especially when you consider some parts of some areas in Lagos. I'm not going to mention some areas like that. But of course, what we actually need to do after accessing those patients based on their symptoms, and you now discover that such a patient can self-isolate, you go do the second stage, which is trying to assess the home setting. You can't just tell someone go on and self-isolate and they're 10 in that room. How would the person self-isolate? So in most cases, the government need to look at the area. If the home setting is not so conducive for self-isolation, we can still look for a place in that same community where people can self-isolate, provided their cases are just mild to moderate. And of course, there should be people they can talk to, like if the case is actually getting out of hand. Because by the time you start noticing that the patient who comes with just asymptomatic suddenly can become symptomatic. Fine, that might not be very common, but we have to tell the patient, educate them on what signs, when they see certain signs, and who to call so that they can get attended to.
All right, we appreciate your time. Thank you so much, Dr. Adewale Adebanjo, public health physician. Thank you for joining us on the program.
Thank you very much.
Now, the United States is approaching 6 million total coronavirus cases. This is according to Johns Hopkins University. Now, it currently shows that 5,996,431 confirmed infections and close to 190,000 deaths, the world's highest death toll. Our website, channelstv.com, has the latest updates on the pandemic. You can take a closer look at some of the stories coming in there from Nigeria, Africa, and across the world at your fingertips. That's the program this afternoon. Thank you for watching. I'm Millicent Nwaka. Stay safe.